Hello guys, welcome back to Medico DIY, and today in this video we'll be talking about Gastro-Esophageal Reflux disease. It is also known as GERD. Gastro-esophageal reflux disease, also called as GERD, it is a medical condition which is characterized by excessive reflux of gastric content into the esophagus, and this results in either troublesome symptoms or an array of potential esophageal and extraesophageal manifestations, which we'll be discussing later in this video. GERD is very common and it affects 30% of the general population. Talking about the risk factors, there are various risk factors which are involved in causing GERD, and some of the risk factors are included in this video. Number 1. The lower esophageal sphincter abnormalities. In some patients, there is reduced tone of the lower esophageal sphincter, and this results in reflux of the gastric content into the esophagus when the intra-abdominal pressure increases. While in some patients, the basal tone is normal, but there is frequent episodes of inappropriate sphincter relaxation resulting in reflux. GERD is also very common in patients with hiatus hernia. In patients with hiatus hernia, the pressure gradient between the thoracic and the abdominal cavities is lost, and the oblique angle between the cardia and esophagus also disappears, which results in reflux of the gastric content into the esophagus. It is also very common in patients who take increased amount of dietary fat, chocolate, alcohol, tea, and coffee. This results in relaxation of the sphincter, and hence the reflux of the gastric content into the esophagus. It is also common in patients with defective esophageal clearance, as in patients with esophagitis, which leads to increased acid exposure time. Gastric acid, it is one of the most important esophageal irritant, along with bile acids and pepsins, which causes mucosal injury. And another factor is also defective gastric emptying. And GERD is also common in patients with increased intra-abdominal pressure, as in pregnancy and in obesity. And there is also patient factors. Now let's talk about the clinical features of GERD. The patient with GERD presents with heartburn, regurgitation, which are provoked by bending, straining, or lying down. The patient also presents with water brash, and the patient is often overweight. Some patients are woken at night by choking as reflux fluid irritates the larynx. Some patient also presents with odynophagia, dysphagia, and some patients also present with atypical chest pain, which mimics angina. It may be due to reflux-induced esophageal spasm. Talking about extraesophageal syndromes, the patient may present with chronic cough, chronic sinusitis, laryngitis, asthma, dental erosions, pharyngitis, chronic bronchitis, recurrent chest infections, sleep apnea, cardiac arrhythmias. In examination, there is epigastric tenderness, wheeze, or dysphonia. Talking about the complications, there are various complications related to GERD. Some of them are esophagitis, Barrett's esophagus, and esophageal stricture benign type, and in esophageal stricture the patient presents with dysphagia that is worse for solid than for liquids. The patient may also present with iron deficiency anemia or gastric volvulus, which leads to complete esophageal or gastric obstruction, and patient may present with severe chest pain, vomiting, and dysphagia. In this picture we can see that this is a picture of esophagitis, Barrett's esophagus, and the stricture in the esophagus. Now talking about the investigation, if the patient is young and presents with typical symptoms, then such patients can be treated empirically without any investigation. But if the patient is more than 50 years or presents with atypical symptoms or complication is suspected, then in such patients investigation is needed. And the investigation of choice is endoscopy, and it may show features of esophagitis. 24-hour pH monitoring is also done. The pH of less than 4 for more than 6 to 7% of the study time is diagnostic for GERD. The impedance testing is also done in patients with difficult reflux. Barium swallow can be done, which may show structural abnormalities like hiatus hernia or stricture in the esophagus. The esophageal manometry is done to rule out the neuromuscular disorder. In this picture, we can see that there is esophageal strictures. Now talking about the management is divided into 3 types, that is lifestyle modification, medical treatment, and the surgical treatment. Talking about lifestyle modification, it includes weight loss in patients who are obese, avoidance of food that aggravates the symptoms like spicy food, elevation of the bed head in patients with the nocturnal symptoms, avoidance of the late meals, and cessation of smoking, and also avoid lying down for 2 to 3 hours after meal. If the patient is not cured by the simple lifestyle modifications, then such patients may be treated with medical treatment like giving proton pump inhibitors, which is the treatment of choice. And in patients with PPI, recurrence of symptoms is common when the therapy is stopped. And if the patient is under long-term PPI, it may be associated with various complications like decreased absorption of iron, vitamin B12, magnesium. The patient is an increased risk for osteoporosis, fracture, and there is increased chance of enteric infections with Salmonella, Campylobacter, Clostridium difficile. And there is also increased risk of Helicobacter associated progression of gastric mucosal atrophy. Therefore, in patients with long-term PPI, the Helicobacter eradication therapy is required if the patient is under PPI for more than 1 year. The patient may also be given H2 receptor antagonist and antacids. And if the patient is still not cured by the medical treatment, then the surgical treatment is implemented, like anti-reflux surgery for patients who fails to respond to medical therapy, laparoscopic fundoplications like Nissen's fundoplication, modifications like partial fundoplication, and endoscopic for stricture dilatation or surveillance of the Barrett's esophagus. This much for today. Hope you enjoyed the video. Stay tuned for more videos, and do give me any suggestions. Stay tuned for more videos. Thank you.